You're listening to an IOE podcast.
Powered by UCL Minds.
This is Research for the Real World. Conversations with researchers about the paths they've taken to shape our everyday lives.
This is Research for the Real World. Hello, I'm Dr. Laura Outhwaite and I'm a Senior Research Fellow in the Centre for Education Policy and Equalising Opportunities at IOE, UCL's Faculty of Education and Society. In this season for Research for the Real World, we are exploring the ways in which socially relevant research can be translated into policy and practice by our IOE researchers, contributing to tackle challenges at a global scale. So on this episode, I'm absolutely delighted to be talking to Professors David Gough and James Thomas. David is a Professor of Evidence-Informed Policy and Practice and the Director of the Epicentre in UCL's Social Research Institute, based at the IOE. He's also the co-chair of the Network Evidence Synthesis International with Professor Jeremy Grimshaw of the Ottawa Health Research Institute, and an active partner in the COVID-End International Network for enabling access to research on global health outbreaks. His research centres on the study of methods for research synthesis and the study of research use. He has previously worked at the University of Glasgow and Japan Women's University. We are also joined today by James. James is a Professor of Social Research and Policy and is the Deputy Director of the Epicentre. He is also the Director of the Epicentre's Review Facility for the Department of Health and Social Care in England. He undertakes systematic reviews across a wide range of policy areas to support the government. James is interested in developing methods for research synthesis, in particular for qualitative and mixed method reviews. He is also interested in using emerging information technologies such as machine learning in research. So you both work at the IOE Epicentre, and I'm really keen to know more about the range of activities that you are developing around research synthesis and research use, especially as it benefits so many different areas of social policy, including education, healthcare, and social care. But first, it'd be great to know a little bit more about you both. So I'll start with you, David. How did you become involved in education? Can you tell us more about your own experience at university and how you got to be where you are now?
Hi, thanks, Laura. So I did a psychology degree and was wondering what to do next. And there was this really interesting master's course at the Institute of Education on psychology and child development. So I did that course and it was really interesting and it set me off on an academic career. And I went to work in Glasgow for many years. And then, very surprisingly, I was offered a permanent job in Japan. And I couldn't resist that. But after 6 years, I thought I really needed to get more back into the academic swim and just to be living in England. And so I was looking out for jobs. And to my great surprise and great luck, this post was advertised in the Social Science Research Unit at the Institute. And I applied and I got it. So I was a very happy person, and I've been there ever since for now 23 years, a long time.
Excellent. So like you say, the rest is history, really. James, you've recently been named in an annual global list of most influential researchers around the world due to highly cited publications. That's really, really great to hear, so congratulations. Looking back, how did you become involved in working in education, and how did you also get to this point?
Like David, I had a sort of an unplanned arrival really at the Social Science Research Unit. When I did my first degree, I did music. I did lots of piano playing. But at the time, I was also considering journalism as a career because I was really into research, and also computer science because I had a job at one point building computers and programming them. So it was a bit of a mixed history, but what I ended up doing was arriving at the Social Science Research Unit, like many researchers, on a short-term contract. But unlike many institutions, the Social Science Research Unit has really nurtured early careers researchers, as they call them. And one research contract led to another. And what I found was that this type of research suited my personality type, and it was very varied. And also it gave me the opportunity of sort of making a difference in terms of both doing research, but also thinking about how that research might make a difference in terms of policy and practice. So a slightly unusual history probably, but I think it probably reflects how Anne Oakley, the sort of founding director of the unit, went about putting teams together, because she actually quite deliberately put teams with people with different backgrounds together and found that you would get quite a lot of strength from different perspectives sort of contributing to the research process.
So within the Epicenter, you do a lot of systematic reviews to help inform policy and practice. But before we start talking about some of those findings, can you just tell us a little bit about what exactly systematic reviews are and why they're so useful to inform decision making at a global scale? David, could you help us there?
Sure. First of all, I should also say one of the reasons I was attracted to Social Science Research Unit was because of its interest, as James said, in applied social research, for social research to be useful and to make a difference. And also that there was a great belief from Anne Oakley, the founder again, that we should see research as a democratic issue, that research was there to enable society, and there should be democratic participation in that process. So systematic reviews are about how do we bring together evidence to inform policy practice and individual decisions. And historically, that's been rather ad hoc. It's either been ad hoc as a review process, or it's by asking experts to let us know what is known from research. But as research becomes so extensive, it's quite difficult for individual experts to be able to do that. So just as we have methodology for doing research, primary research out in the big wide world, we need to have more formal research processes for bringing together what we know and how we know it. So systematic reviews is just being systematic, rigorous, and transparent about how we bring together evidence. It seems very, very obvious, but surprisingly, it's only been in the last kind of 20 or 30 years that it's been given a good amount of attention. And the Epicenter was developed by Anne Oakley to try and develop our approach to that. And it's really important to say that these reviews are not just for any particular questions or, for example, impact of different health interventions. It's for any research question that you might do at the primary level. We also need to have methodologies for how we bring them together. And as we're particularly interested in complex questions, that may be bringing together lots of different issues. And just the last final thing I'd say is that, as with all research, the research question is crucial, but research questions are driven by different perspectives, your theoretical, ideological assumptions and priorities. And if you have three academics in the room and you ask them opinion or their knowledge of the evidence, that evidence may be different because the way they're framing the issue, their assumptions and priorities are different. So as well as being very explicit and transparent about methods, we need to be very explicit and transparent about the perspectives which are framing the questions and therefore the research. So the Epicenter is basically a specialist center for developing these approaches to systematic reviewing.
Excellent. So if I wanted to learn more about the current work at the centre, you're undertaking to meet the demand for social research in relation to COVID. You're a lead partner with the International Public Policy Observatory. What's the aim and goals of this project?
It's to do very similar approaches. The very significant difference is that a lot of research funded through academia, through research councils like the SRC, is asking academics what they think is really important. But the IPPO, that's how we call the observatory, IPPO is starting off with policy demand. It's saying, what do policymakers want to know from research evidence that will help develop policy making in relation to the pandemic? So it's a demand-led process rather than just saying what research is out there. It's saying what research questions do we need answered? And then IPPO engages with the policymakers to find that out. And then we try to go and find the relevant evidence to fulfill that need and to feed it back. So in a way, it's a bit of a different model of framing research, being policy driven rather than being academically driven. But James is going to talk later about the Department of Health, and that's quite similar in a way because it's a government department explaining what their needs are.
That's really, really interesting. So I know that one of the results from this collaboration so far was a series of rapid reviews completed for the Department for Education, particularly focusing on the effects of school closures, colleges and universities during the lockdown. How have these closures impacted the different educational settings?
Well, these reviews were, the demand from that came from SAGE, which are the advisors, the academic advisors to government, and particularly important at the moment during the pandemic. And they went to the Department of Education to ask this question, and then the Department of Education commissioned us to do some of this work. And it was quite varied on different types of education. And there's really two sides to it. The first is, what are the problems that have arisen from pandemic, which would be very recent evidence because it's only since the pandemic that we can know about those problems. And then a much broader look at the research evidence as to what might be helpful to respond to those issues. And that research about what might be helpful could be before COVID, and it could be broader than UK. Because these are very broad questions and they're bringing together evidence on a wide amount of issues, it's quite broad, the evidence. But in terms of the impacts of the pandemic, I think people will know well from reading the newspapers the type of effects this damage it had to children's learning, mental health, increased exposure to risk factors at home, physical health, and things like that. But we also did a review about parents and carers. Again, that's been a lot in the media, that there were particularly big impacts on mothers, on single parents, those on lower income, and families with children with special educational needs. So, really the take-home message from that, apart from the breadth of issues, is that it had a disproportionate effect on certain sections of the community. So those who were most vulnerable pre-pandemic were more impacted by the pandemic. In terms of responses and how to enable that, to try and make these things better, the real take-home message was that the problems and challenges that the schools faced were very varied, and the schools were themselves in the best position to determine the details of the recovery plans that were available. And also linking in with the issue about the effects on families, that the schools were in a really good position in their community, so that one shouldn't just see the school or education in isolation, but to see them as a bit of a hub for identifying issues and finding solutions, to be a focal point for different services. And again, that, in terms of specifically about learning, of course, moving to online has been, there've been quite a lot of advantages and learning that have been from that. But it does mean that we need to identify where problems arise with that. We need to develop training and resources for teachers to deliver that, and that seeing the schools as a local hub, that the parents need to be looked at as well. So, if parents have mental health stresses like anxiety, then providing services for that might assist also in any problems that children may be having, including anxiety problems. And there's also the unfortunate thing that some children don't always have a wonderful time at home, and the lack of schooling meant that some of them were losing out both on nutrition and in protection. So it's easy to forget the central role that schools play in monitoring the welfare of children in our communities. I should also just quickly say that we've also, as part of mainline work for IPPO, we've done a review about online learning and approaches to to do that, to improve that and develop that. And we're about to start a review on population mental health, because although we have lots of specialist services for mental health issues, they tend to be for a relatively small proportion of the population. And we've become more and more aware that actually quite a lot of the population have mental health problems that they could be provided with support for. So we're planning a review on how to scale up or provide mental health services for things like anxiety and depression that could be offered to a greater proportion of the population.
Thanks, David. It does really sound like you're doing a lot of really impactful work, and it's really great to hear about how you're addressing really key issues across different areas of society. So, James, as part of your work with the International Public Policy Observatory, also known as IPPO, you've been producing a living map of systematic reviews of social science research on COVID-19. Can you tell us a little bit more about the importance of this work, particularly in the era of disinformation?
Yeah, sure. Thank you. I think it comes back to what David was saying earlier about the importance of looking at research systematically and looking at knowledge in the whole. This has become known as an infodemic as well as a pandemic. There must be something around approaching 500,000 papers now on COVID-19 published. And we've probably looked at least half of them now. And about a fraction of them are actually research papers. So we've got different maps that we're supporting in the epicenter. There's the IPPO map, which is focused on systematic reviews. And that really is sort of in line with the principle of looking at research as a whole rather than just cherry-picking individual studies. And we've also got a couple of other maps which are looking at primary research. There's one map which is sort of looking across the whole of COVID-19 research findings, not sort of think pieces and opinion pieces. And I think we've got about 92,000 papers in that map now. And more recently, we've started work on a sort of a section of that map on long COVID, which is obviously becoming increasingly important to keep up to date with. And there are over 400 research papers now on long COVID. That's not opinion pieces, that's actual papers with research findings in them. Not very much in terms of treatments. And I think that's one of the things that maps are really good for, is that they help us to keep up to date with the evidence. So they're a shortcut to finding what we know. But because of the way that you can classify the records in a map, they also tell you what isn't there. So at the moment, we can see that there are research gaps in terms of treatments for long COVID. There are some very noticeable gaps in the IPPO map in terms of especially interventions and other types of research on particular groups associated with health and other inequalities, for example. So we can see where the investment in research has gone. And the other thing that we've really noticed doing maps in COVID is just how quickly the evidence base has grown, but also shifts as it moves. I mean, there's remdesivir, which is an interesting case in that, in the early days, it was a treatment originally developed for Ebola, and there was weak but promising data saying that it can be used for treating COVID-19. But there are now 14 randomized trials, 52 papers have come out over time just on that one treatment. And systematic reviews have been done on that. And some of the systematic reviews have actually been out of date at the time that they've been published because more studies have been coming out as we've been going. So that really leads me on to a sort of important point. And one of the sort of characteristics about these maps is we've called them living maps, in that they're keeping up to date with the emerging evidence base as and when it comes out. I think the other point that we really see in these maps, and it's a real gap at the moment, is yes, we've got 500,000 papers, we've got 100,000 or so research papers in that lot, but an obvious gap is around the social interventions that we've all experienced. There have been some fantastic randomized trials of vaccines and of treatments, but how many good interventions and good evaluations have we seen on some of the social distancing interventions? And what happens if you don't keep an eye on where the distribution and where the investment in research is we've ended up now with a place where there's basically a gap in research knowledge. And that gap in research knowledge in the social interventions, which we've all experienced, has then been filled by misinformation. And the misinformation does huge harm, and we can see sort of health outcomes arising from it. But the evidence, in a way, is there in the map. There is a big gap there, which at the moment we need research commissioners and people doing research to be aware of and to start to fill. So the maps are really helpful. We find that obviously they keep us up to date with what's there, but they also tell us what isn't there. And sometimes knowing what's not there is just as important.
That sounds really, really fascinating. And I really like this idea of a living map. Yeah, when you're saying about sometimes when systematic reviews have come out and they're already out of date, like it is really, really hard, even as a researcher, to stay up to date. So yeah, it's really fascinating to see some of these advances in evidence synthesis. So James, you've also been producing systematic reviews for the Department of Health and Social Care. What's been the impact of this work so far?
I think I should preface this by saying that I and the group of people who work on it, it's a great team, I feel very fortunate to have had the opportunity to do this work because it's been over a long period of time. And we've worked with some really great policymakers at Department of Health and had some great collaborators. So I definitely need to mention the fact that the team is also based at the University of York, the Centre for Reviews and Dissemination, and London School of Hygiene and Tropical Medicine. So it's a good collaboration across institutions. I think probably looking back, there are probably three main ways of thinking about its impacts. First of all, back in the early days, we were very much making the case to the Department of Health that policymakers, decision makers, both within national and local government, should be using research evidence to inform their decision making. It sounds very obvious now, evidence-based, evidence-informed policy. But back then, we were making the case for it. And we were saying these things called reviews give you that shortcut to the evidence, and they're a good way of understanding the totality of knowledge rather than sort of cherry-picking potentially atypical primary research studies. So what we've noticed over the years now is that systematic reviews and other types of evidence synthesis are just more and more expected parts of the policy-making process. And there's now more demand for doing reviews than certainly we can keep up with them, and that there is capacity to supply. So from that point of view, it's not just us who've made that impact, but we've been part of that move towards using the totality of evidence, or as much as possible, when making decisions. Part of the work, as David mentions, has also been around changing the methods to broaden the scope of reviews. We saw ourselves in the early days as really sort of looking at sort of reviews that were done in more sort of health and care settings, healthcare settings, to more social settings. And that's meant using lots of different types of methods, including lots of different types of research in the process, and also integrating other types of evidence and not just research evidence. And as David said, a really important part has been the perspectives of people who have been affected potentially by policy and interventions. So having their voices as part of the review process has been important. And we've been fortunate enough to be able to sort of be involved in some of the hot topics of policy of the day. So we've been involved in, for example, the plain tobacco packaging work a few years ago. We did some of the evidence synthesis work to support that. We did some of the evidence synthesis work to support the work that the Department of Health has now done in terms of revising the compensation offered to people who contracted hepatitis C through contaminated blood products. There's been a compensation scheme for medically acquired birth injury in England, and again, we were involved in the evidence synthesis for that. A series of work on paediatric medication error. We worked with Chief Medical Officer on screen-based activities for children, weight management programs for adults and children and young people. And more recently, in terms of COVID, we did some rapid work with a group of, a team of people working at the Department of Health on aerosol generating procedures. So what's fascinating about this work is that you go from sort of social to actually sort of quite clinical research questions at times. You never know quite what you're going to be asked to do next, but that's part of the interest and the fun of it, because I never expected to know as much as I now know about aerosol generating procedures. But you can see that at the time that was an important question for the health service to be looking at.
Excellent. It's great that you get to be so broad and have such great impacts across that board. So yeah, really fascinating to hear. You also have a particular interest in software. Could you tell us a little bit more about the software that you do use for reviews, James?
Yeah, sure. I mean, it sort of stems from that earlier statement I made. There's so much research out there. 500,000 papers on COVID, for example, and obviously there are way more research papers in general than that about everything else. So what's been frustrating about doing evidence synthesis for decision making is how long it takes just to lay your hands on the relevant studies. And so it was over 10 years ago now that I started working on, in particular, the machine learning to find things more efficiently and to help us focus actually on reading the papers that we did need to read rather than sort of sifting through thousands of irrelevant ones. But sort of going further back than that, we've had a long history of needing to manage our review data efficiently across a team and across different geographies. And that led us to developing our own software, the software for reviews, EpiReviewer, which we built for ourselves to use and then made available for other people to use. And so it's had quite a long history, but it's very much user-led in terms of, if there is a new review method that's evolving, then we try and support it, and we try and support lots of different types of reviews in the software. So, in terms of where we're going next with it, I think we're moving into a period now where data and research publications are becoming increasingly open. And so we've now got a database of about 250 million records, currently based on Microsoft Academic, moving to the OpenAlex dataset next year. And so we probably have nearly all the relevant studies actually in our database for any review that we start. And so the problem comes, changes from trying to sort of search lots of databases to find them to actually how do we find them efficiently within the data set that we've got. And so that's where we're working with a number of people on, called AI, but it's mostly machine learning, to sort of try and develop methods and tools to do that efficiently.
So just going back to you, David, what's next for you?
I'd like to repeat the kind of central role of synthesis within the epicenter's work, not just to inform policy and practice and individual decision making, but as James said, also to inform the planning of future research. And if you listen to the radio or watch the TV, people are often responding to individual studies, and for us, that's the wrong way of thinking about it. You need to think about the totality, the whole knowledge. And if there's a new study, how does that add or change what we already knew? And also, I used to study children's social care, but I've now become a bit separated from that because our speciality, is about doing reviews. And it's great to have the Department of Health program on those range of topics that James explained. But other government departments and other funders fund different things. My last two reviews that I've been involved in one has been about student knowledge exchange, which is about how students' learning is beyond the curriculum. But it's also, another one I've done is on interfaith dialogue, on about how people from different religions can work peacefully together. So you can see the range of topics that we bring. Our topic specialism is in synthesis. But the area where we're moving forward on is about how research is used in practice. There are lots of different names for that, but it's research on research use, research on how research is used in practice. One of the main findings of that is that just providing access to research to decision makers doesn't mean that the research will be used to help inform the decision. The Education Endowment Foundation, which is a What Works Centre in Education, which we have very good links with, did an experiment comparing 8 different ways of providing research evidence to teachers to try and see if that would improve or increase the use of research evidence in their work, and none really had much of an effect. And we also done some primary research on this area. It's not going to have an effect if you don't attend to other issues like behavioral components about capacity, opportunity, and motivation to use the research evidence, and infrastructure to support that. So that's the kind of really big growing area of research, is how do we enable research to be used in forming policy, practice, and individual decision making, and that providing access to information or enabling relationships between academics and decision makers is maybe a necessary, but is not sufficient. We need to work on these behavioral and infrastructure components as well. So that's the kind of the new frontier that we're working on.
That's really, really exciting, and I wish you all the best in pursuing that endeavour. Is there anything further for you to add, James, in terms of your future goals and interests?
Yeah, I think David's explained it perfectly. It's around how we can actually better contextualize and use evidence and find ways in which can support people better, sort of in both directions, how we can produce evidence which is more usable and more useful, but also how we can support people in making decisions in the light of evidence. And I think one of the things that is clear, the clear thread here is that there is some work that we in universities can do to put our house in order a little more in terms of our publication processes and not just basically losing research as soon as it's published, so that we've got better infrastructure in place to reuse research. But also I think we need to think when we're doing primary research about its contribution to existing knowledge. There are lots of sort of potted studies which don't really then draw out how their particular study then fits in with what's already there. And so I think that that's a cultural change which it would be great to start sort of seeing shift. There's always sort of the idea that you locate your research within a body of existing knowledge. We need to move maybe beyond that into thinking, well, how does this one study then contribute and update our existing knowledge? So potentially sort of embedding some kind of updating a review within the publication of primary research.
Excellent. So David and James, thank you so much. It's been really interesting talking with you and learning about such the broad range of work that you've been doing. And just personally, just listening, I feel like I've learned a lot already. So thank you. You can follow David on Twitter at Prof. David Gough and James at James_M_Thomas, as well as the Epicenter to learn more about their research. Some of what was covered today is also available in the episode notes. If you've enjoyed this episode and you want to find out more, there's our archive of the past 12 seasons available to listen to. Search IOE Podcasts from wherever you get your podcasts to find more research for the real world episodes, as well as more podcasts from the IOE. I'm Dr. Laura Outhwaite. Thank you for listening.
Research for the Real World is produced by IOE Marketing and Communications and IOE Research Development. The theme music was created by Rob Cochran. Tatiana Sotero Diaz is the series advisor, Amy Leibowitz is the series producer, and Jason Ilagan is the executive producer of the IOE podcast.
Thanks so much for downloading and listening to this IOE podcast.